Hey gang, so here's your week 5 wrap up. We talked about regional interdependence this week. So here's some of the evidence that we did talk about. In elbow pain, one of your required readings, Berglund found that proximal dysfunction is more the norm for patients with lateral epicondylgia. Fernandez-Carnero, we talked about this one a little bit during the lateral elbow pain week, but thrust manipulation to the cervical spine increased the ipsilateral elbow pain pressure threshold by 35% and pain-free grip strength by 25%. So that's something that kind of blew my mind when I first read this and was going through this material myself. So Cleland, that we read, found that if we include that proximal treatment, that those patients get better faster. So for shoulder pain, Strunz was one of the required readings. So rib manipulation for shoulder pain. We've talked extensively about thoracic manipulation and shoulder pain. And then VAD found in those tennis players about the hip internal rotation, low back pain, and shoulder internal rotation, and leading to shoulder pain. This article was by Mahuto Vasquez. So these were patients with acute neck pain, I think in the last 7 to 10 days. And they had a dry needling group where they dry needled the upper trap versus a controlled, a weightless. So to orient you here, these are the outcome measures that they used. They measured these again at 10 minutes, and then they measured them at 1 week, and this is the difference that was found. So these are not the raw data here. It's the change from baseline. So you can see that, things that you might expect to be better, the pain pressure threshold at C5-6 was improved, but all the way down to the second metacarpal improved, and then even down to tib anterior. That wasn't significant at 10 minutes, but continued to improve over the course of a week, and for a pretty robust change there. Another one here, just trying to get you guys out of the box thinking. This one was by Howell, and it certainly did have some methodological issues, but this was looking at predictors from ankle and hip mobility on baseball pitching performance, and they used coach's rating of performance and ball velocity as outcome measures there. So they found some moderate strength correlations between coach's rating of performance and ankle dorsiflexion, and their dominant hip internal rotation, and then even a little bit stronger correlation between ball velocity and their ankle dorsiflexion and hip internal rotation on their dominant and non-dominant side. So especially in our athletes that are using their whole body to accomplish a motion, whether that be pitching or our CrossFitters that are not just our CrossFitters do Olympic powerlifting, but that's just what comes to mind. And so we do have to take into account a lot of different joints when we're thinking about those complex movements that they're doing. So, we also talked a lot about this week, it came up several times, whether we are truly treating something biomechanically, and that has less and less literature the more we look at it. And there's more literature going towards the neurophysiologic effect of our interventions and how we get that therapeutic window, and we can help them help create that therapeutic window through exercise. And that's something that came out in Coronado's article this past year on he used the shoulder model and manipulated cervical spine versus shoulder manipulations versus exercise, and exercise really did quite well. So we can't forget about that. So upcoming, the group projects discussion should be going on all this week. This part is not in your syllabus, but I do want you to post a rough draft by Saturday midnight so that I know that everybody is doing something and that you've taken a look at the subjective. I think it's very valuable to break this up this way in a case in real time and trying to break up a case real time where you're going through the subjective and kind of reordering your hypothesis list, and then forcing you to methodically think about your hypothesis list and what you want to look at before you go into the objective exam and what you expect to find there. I think is valuable process to go through. So post that rough draft on those subjective stimulus questions and things that you want to look at by Saturday, and I will release the objective information next Sunday. And then the final product is due Monday of week 8, and that is October 26th. And then we will all kind of discuss it during week 8. Next week we have adhesive capsulitis and proximal humerus fracture. And I'll leave you guys to it. Have a wonderful week.